Your body often gives you subtle signs when something's not right. Some of these signs are easy to ignore, but others, well, they could be far more serious than you realize. Today, we're going to discuss some physical symptoms that should never be brushed aside. These are the ones that need your immediate attention. Now, don't worry. This isn't meant to scare you. It's all about being informed and staying ahead of any potential health issues. A lot of older adults tend to delay getting help, thinking it's just a minor problem or because they don't want to bother anyone. But in many cases, taking action sooner can make all the difference. Recognizing these warning signs early could prevent a small issue from turning into a big one. In this video, we'll walk through the key warning signs that doctors say should never be ignored. These aren't vague or hard-to-spot symptoms. They're real, specific issues that could need urgent care. Stick with us until the end, because one of these signs could be the thing that saves your life or the life of someone you love. Before we dive in, please comment below with the city you live in, and don't forget to like and subscribe to our channel for more valuable insights and tips. Now let's get started. Sign 1. Slurred speech or facial drooping. Have you ever had moments when your speech feels off? Or your face just doesn't seem to move the way it normally does? These may seem like small issues, but they can actually be signs of something much more serious. Sudden slurred speech, or a drooping on one side of your face, might be signals of a stroke. A stroke is a medical emergency, and time truly matters when it comes to treating one. If you notice your speech becoming slurred, or if one side of your face feels weaker or droops, it's important to take action immediately. You might feel like it's something that will go away or that it's not a big deal, but the truth is that quick intervention can drastically improve your chances of recovery. A stroke occurs when the blood flow to part of your brain is interrupted, and if not treated fast, it can cause permanent damage or even be life-threatening. Think of it like this: the sooner you seek help, the better your chances of minimizing the damage. Doctors say that in cases of stroke, every minute counts. Getting medical help within the first few hours can make a huge difference in recovery outcomes. And remember, strokes don't always come with dramatic symptoms. Sometimes they start with subtle changes, like a slight weakness on one side of your face or difficulty speaking clearly. So, if you notice slurred speech, facial drooping, or weakness on one side of your body, don't wait. It might be the first sign of a stroke, and immediate medical attention is key to saving your health and possibly even your life. Sign 2. Sudden chest tightness or pain. Imagine you're just sitting there, maybe watching TV or enjoying a quiet afternoon, when suddenly you feel a tightness or pressure in your chest. At first, it might seem like something small, just a bit of discomfort. But that feeling of tightness, pressure, or even pain in your chest is something you should never ignore, especially as you get older. Could be a sign of a heart attack. Heart attacks don't always show up with the dramatic symptoms we often see on TV, like clutching your chest and falling to the ground. In older adults, the signs can be much subtler. You might just feel a little tightness, a dull pain, or an unexplained discomfort in your chest. Can even feel like heartburn or indigestion. But that discomfort can be your body's way of telling you that something isn't right with your heart. If you experience chest pain, tightness, or pressure that doesn't go away, it's crucial to seek help immediately. Don't wait around to see if it gets better on its own. The sooner you act, the better your chances of avoiding more severe damage to your heart. Doctors often stress that time is of the essence when it comes to heart attacks. Getting medical treatment quickly can save your life and prevent long-term damage. And remember, even if the chest pain is mild or doesn't seem like an emergency, it's always better to get checked out than to risk ignoring something that could be life-threatening. Your health matters, and catching things early can make all the difference. Sign 3. Shortness of breath without exertion. Have you ever noticed that after some physical activity like walking up the stairs or going for a short walk, you feel out of breath for a moment? It's completely normal to get winded after exertion. But what if you're sitting down, resting, or even lying in bed and suddenly you can't catch your breath? That's not normal, and it's a red flag that shouldn't be ignored. Shortness of breath without exertion can be a sign of several serious health issues. It could indicate heart failure, where your heart isn't pumping blood as efficiently as it should. It might also be a sign of pneumonia, which is an infection in the lungs, or even a pulmonary embolism, a blood clot in the lungs that can be life-threatening if not treated immediately. For older adults, these symptoms can come on gradually and might seem harmless at first, but they're often your body's way of alerting you to a bigger problem. If you find yourself struggling to breathe, even when you're not doing anything physical, it's important to seek medical attention right away. Your lungs and heart are working hard to keep you healthy, and when something disrupts that balance, it can quickly become a serious issue. Don't wait. Getting help early is key to preventing things from getting worse and could help you avoid an emergency down the road. If you're ever in doubt about your breathing or how it feels, don't hesitate to call your doctor or go to the hospital. Sign 4. Unusual confusion or sudden disorientation. Imagine you're sitting in your living room, having a peaceful afternoon, when suddenly you feel like you're in a fog. The things around you seem distant, and you might struggle to remember simple things like what day it is or why you walked into a room. This kind of sudden confusion or disorientation is not something you should ignore. When it comes to older adults, sudden mental changes can be alarming. It might feel like just a temporary lapse, but it can be a warning sign of a serious condition. Abrupt confusion can be linked to a number of health problems, including a stroke, a brain infection, low oxygen levels in the blood, or even a severe reaction to medications. One of the most common causes of sudden disorientation is a stroke. Strokes can impair brain function quickly, and confusion or memory loss often happens in the early stages. But other conditions, like infections in the brain, meningitis, or encephalitis, can also lead to this kind of sudden mental shift. In some cases, it could be due to low oxygen levels, which can occur with heart problems or respiratory issues. If you, or someone you know, experiences an episode of sudden confusion, it's crucial not to wait it out. Don't assume it's just a momentary lapse in memory. Seek help as soon as possible, whether it's calling a doctor, going to the hospital, or reaching out to a caregiver. Time is essential when it comes to treating the underlying cause of confusion. The sooner you act, the better the chances are for recovery and avoiding further complications. Sign 5. Severe or sudden abdominal pain. Abdominal pain is something almost everyone experiences from time to time, whether it's from indigestion, gas, or a little too much food. But when the pain is severe, persistent, or suddenly sharp, it could be a sign that something far more serious is happening inside your body. If you or a loved one experiences this, it's important not to ignore it and get medical attention immediately. Severe abdominal pain could be linked to a number of serious medical conditions, such as appendicitis, pancreatitis, or even a ruptured organ. For instance, appendicitis, which is inflammation of the appendix, often starts with pain around the belly button that gradually shifts to the lower right side of the abdomen. If not treated quickly, appendicitis can lead to a ruptured appendix, causing infection and other life-threatening complications. Pancreatitis, an inflammation of the pancreas, can also cause intense abdominal pain, which may radiate to the back or chest. This condition can develop suddenly, especially if you've had a history of gallstones, heavy drinking, or certain medications. A ruptured organ, such as a perforated ulcer or a torn blood vessel in the abdomen, can lead to intense pain and internal bleeding, which requires immediate attention. The key here is to recognize that sudden, sharp, or constant abdominal pain is a signal that your body needs help. It's not something that should be waited out. If the pain is severe and doesn't go away, or if it worsens over time, you must seek medical care right away. It's better to have it checked out and be reassured than to risk ignoring a potential emergency. Ignoring severe abdominal pain could lead to complications or permanent damage to your organs, so don't hesitate to reach out for medical help as soon as possible. Trust your body. If something doesn't feel right, it's better to be safe than sorry. Sign 6. Persistent vomiting or vomiting blood. Vomiting is a common and often temporary issue, whether from a stomach bug, food poisoning, or a reaction to something you ate. But there are times when vomiting goes beyond the typical. When vomiting is persistent, especially if it's accompanied by blood, it can be a sign of a much more serious health issue, and it's essential to seek immediate medical care. Persistent vomiting can be caused by a variety of underlying conditions, including severe infections, a blockage in the digestive tract, or an issue with the brain, such as a concussion or a stroke. However, when blood appears in the vomit, it's a medical emergency. Vomiting blood, or hematemesis, is a sign that something serious is happening within your gastrointestinal system, and it must be treated urgently. The blood you see may appear bright red, which often indicates recent bleeding, or it might look like coffee grounds, which suggests that the blood has been in the stomach for some time. This could point to conditions like a bleeding ulcer, esophageal varices, or even a tear in the lining of the esophagus. A bleeding ulcer, which can be caused by excessive use of nonsteroidal anti-inflammatory drugs, NSAIDs, excessive alcohol consumption, or an infection from H. pylori bacteria, can lead to significant blood loss if not treated right away. In the case of esophageal varices, these swollen veins in the esophagus can burst and lead to rapid blood loss, which can be life-threatening if not controlled quickly. If you or someone you love experiences persistent vomiting, especially if blood is present, it is essential to act fast and get to the hospital as soon as possible. This could be a matter of life or death, and quick intervention can prevent further complications. It's also important not to wait it out or dismiss it as something minor, especially in older adults, as they may have a higher risk for complications and may not always display classic symptoms of serious conditions. Don't hesitate. If you or someone around you is vomiting blood or cannot stop vomiting, seek medical attention right away. Time is critical, and early treatment can help stop the situation from escalating into something far worse. Sign 7. High fever with stiff neck and sensitivity to light. A high fever is usually a sign that your body is fighting off an infection. But when it's combined with a stiff neck and sensitivity to light, it's something that should not be ignored. This trio of symptoms could indicate meningitis, a serious and life-threatening infection that affects the protective membranes surrounding the brain and spinal cord. Meningitis can progress rapidly, and without prompt medical treatment, it can lead to permanent brain damage, hearing loss, or even death. The stiffness in your neck may feel like you have trouble moving your head or that it's extremely painful to touch your chin to your chest. The sensitivity to light, also known as photophobia, can make bright lights unbearable, often causing discomfort or a sharp pain in your eyes. Along with the fever, these symptoms together are a red flag that something may be very wrong. Meningitis can be caused by both viral and bacterial infections. Viral meningitis is typically less severe, but bacterial meningitis is much more dangerous and can progress rapidly, leading to severe complications or even death. Older adults, particularly those with weakened immune systems, are more vulnerable to bacterial meningitis. Other signs of meningitis can include severe headaches, confusion, nausea, vomiting, and even a rash, depending on the cause of the infection. It's important to note that meningitis is not the only condition that causes a fever, stiff neck, and light sensitivity, but these three symptoms together are a clear indication that urgent medical help is needed. If you or someone you know has these symptoms, it's critical to seek care immediately. The faster you can get treated, the better the chances of a full recovery. In some cases, the treatment might involve antibiotics if the infection is bacterial, or antiviral medications if it's viral. Supportive care, such as fluids, rest, and pain relief, may also be necessary. Whatever the cause, though, time is of the essence, and prompt action can make all the difference in preventing severe complications. Remember, you know your body best. If you experience any of these symptoms or notice them in someone you care about, don't hesitate. Seek medical attention as soon as possible. A quick response could save a life. Your body is constantly sending you signals, and recognizing these signals early could be the key to preserving your health and well-being. From slurred speech to severe abdominal pain, every one of these symptoms is a red flag that demands immediate attention. Waiting too long to seek help can turn a manageable health issue into a life-threatening situation, especially for older adults whose bodies may respond differently to illness. Remember, it's never about panicking, but about being informed. The more aware you are of the signs to look out for, the more empowered you become to take control of your health. When in doubt, don't hesitate to reach out to your healthcare provider. Whether it's a small concern or something more serious, your health deserves your attention, and quick action can save a life. Now don't wait. If you or someone you know is experiencing any of the symptoms we discussed today, seek medical help immediately. Your health and safety are too important to ignore any warning signs. And if you found this information helpful, make sure to share it with your loved ones. You could be helping them recognize these critical signs and take action before it's too late. Stay safe, stay healthy, and take care of yourself and those around you. If you have any questions or need advice on what to do next, leave a comment below or get in touch with a healthcare professional. Your well-being matters, and we're here to help guide you on the path to staying healthy.